Hi, my name's Hannah Johnson, and I will be doing my presentation on cystic fibrosis. I'm in Dr. Reed's EXS 486 class. I chose to do cystic fibrosis because I have a dear friend that suffers with the disease, and with his help, I was able to come up with a case study and also get some really good insight about the disease. And I also wanted to learn a lot more about it because I didn't really know much about it before. So what is it exactly? Cystic fibrosis is one of the most common genetic diseases. It causes recurring lung infections and inhibits one's ability to breathe over time. So people with CF usually lose some of their lung capacity with every passing year. It also affects other organs, including the digestive tract as well. People with CF have a mutation in the cystic fibrosis transmembrane regulator. This mutated CFTR gene can cause the CFTR protein to become dysfunctional. As you can see in the picture below, there's a picture of a normal CFTR channel and a mutant CFTR channel. And when the protein is dysfunctional, it's not able to move chloride to the cell surface, which causes the mucus in various organs to become thick and sticky. So the mutant CFTR channel on the right is covered by mucus. It's not able to bring the chloride to the surface, and then on the left side, the chloride is able to pass through. CF is inherited from both parents, and it is life-threatening. The mutation is located in chromosome 7. The child has to receive one chromosome 7 from each parent, and if both are defective, the child will have CF. The average lifespan for a person with CF is approximately 37 years, but that varies, and every year the number gets higher because there's more research being done and more medications coming out that are bettering people with CF. But there is no definitive cure yet. There's a cure on the horizon, but they're still trying to nail down something that will help everyone. So the prevalence of cystic fibrosis, more than 30,000 people live with cystic fibrosis in the US, and more than 70,000 people suffer worldwide, which is a lot of people. Approximately 1,000 new cases are diagnosed each year, and more than 75% of people with CF are diagnosed by age 2. This is a very young age, and usually they can diagnose cystic fibrosis right after you're born. 1 in 29 people of Caucasian ancestry are unaffected carriers of the CF gene mutation. So that means that they carry the CF gene mutation, but they don't show any symptoms of CF. In the United States, cystic fibrosis occurs at a rate of 1 in 3,400 people. So cystic fibrosis is really prevalent in the United States as well as the rest of the world. So how does cystic fibrosis affect the body? It's a very complex disease and it varies person to person. The types and severity depend on a variety of factors. One of the big factors is the age of diagnosis. So as I was saying, the earlier you can catch on to the disease, know that you have it, the easier it is to treat, and you can extend your life by treating it early. The lungs are severely affected in people with CF. Thick and sticky mucus clogs the airways and traps germs, which, as I said, leads to infections, inflammation, and even respiratory failure. So in the picture below, you can see a picture of healthy lungs on the left. They're unobstructed bronchial tubes, so it's a normal airway. And on the right, there's lungs with cystic fibrosis, where you can see there's infection, inflammation. The bronchial tubes are blocked by that mucus that I was talking about. In the pancreas, the buildup of mucus prevents the release of digestive enzymes that absorb food and key nutrients. And as I'll talk about later, people with CF have to orally take enzymes to break down the food that they eat. In the liver, this mucus can block the bile duct, causing liver disease, and in men, CF can affect their ability to have children. So there are a few symptoms of CF. They include persistent wheezing and shortness of breath, lung infections that reoccur, including pneumonia or bronchitis, salty tasting skin, and inability to gain weight or grow. So the diagnosis of CF is a multi-step process. So you can usually catch it early in newborns. So usually they'll do it if they have an idea that a child may have CF, a newborn screening test will be done. It's usually done within the first few days after birth, and they take they take a sample of blood from the heel of the baby and they send it to a lab, and it's tested for a chemical called IRT, which is usually elevated in babies with CF. The best way to diagnose a person with CF is the sweat test. It's the gold standard for accurately diagnosing CF, and it checks for high levels of salt in the sweat. You can also do a carrier test and a clinical evaluation at a CF Foundation accredited care center. So how does exercise affect CF? Although CF affects the lungs and makes it more difficult to breathe during exercise, regular activity greatly improves symptoms of people with CF. As we talk about in class all the time, exercise is medicine. So it usually clears mucus from the lungs. It delays decrease in pulmonary function. It makes it easier to perform everyday tasks for people with CF. It reduces hospital admissions as well as increasing cardiovascular function. Symptoms of the disease can make it difficult for patients to conduct exercise, so it may be difficult for someone to initially breathe while exercising or doing aerobic activity because of the mucus. But once your lungs get conditioned to exercise after, let's say, a few weeks, they will eventually have a higher quality of life. So what are the pharmaceutical indications to CF and how do they affect the exercise response? So usually people with CF take multiple medications and have different ways of dealing with the disease. So usually they take mucus thinners. This makes it easier for one to breathe. It gets rid of the mucus in the lungs and in other parts of the organ, so it lessens the amount of mucus in the airways. Nebulizers are usually used. They're masks with bronchodilator medication, which opens the airways. It allows for more oxygen to be brought into the airways. This could cause an increase in VO2 max during an exercise test. Some people use CTFR modulator therapies. This corrects the malfunctioning protein made by the CFTR gene. And different mutations require different medications. So there's a lot of different mutations when it comes to cystic fibrosis. Everyone's different. As I said, the disease varies in severity and what kind of mutations are present within the disease. There's certain medications for that, and they can cause shortness of breath and tightness in the chest, so you'll have to watch that during exercise if you're exercising someone with CF. As I said, people usually take enzymes. These pancreatic enzymes are taken by the mouth to digest food and absorb nutrients that people usually can digest, but these people with CF cannot digest them. They're taken with food at the beginning of every meal, and the side effects include nausea, vomiting, and stomach pain, but this does not really affect exercise response unless someone's stomach is hurting or something of that sort, then you'd probably have them stop the test. So my case study is on my friend Danny. He's a 21-year-old male who has cystic fibrosis. He was diagnosed at an early age. He's been a relatively active individual, so he played sports up until high school, and after that he followed up with running a few days a week. He liked to run on the treadmill and outside, but he's been busy with the last year with school and work, so he's remained relatively sedentary as of a year ago. He likes to relax after coming home in the evening. It's been about a year since he last worked out, has a normal blood pressure of 118/58 and a heart rate of 70 beats per minute. He uses an airway clearance system, which is a vest that he puts on. It causes him to shake, so it loosens the mucus that's present in the lungs. He also uses Creon enzymes, which are pancreatic enzymes, or Combi, Ursidil, and omeprazole. He also takes vitamin D supplements for liver health. Since he hasn't been exercising regularly, he has been having trouble breathing and suffers from a recurring croupy cough, which is pretty prevalent in people that have CF and don't exercise regularly. He knows how beneficial exercise is in the reduction of his worsening CF symptoms. When he was exercising, he barely experienced any symptoms of CF. he felt good taking his medication and everything, so he hopes to get back into an exercise program that he can follow regularly, enjoy doing, and that can improve his overall health. So the positives of his evaluation are he has a normal blood pressure, normal heart rate. He used to exercise regularly, so he knows what he can handle, but we should still start him off with a low, moderate exercise intensity. He has no family history of cardiovascular disease, which is great, but his negatives include he hasn't been active in a year, so he's going to have to build back up to being active again, and he has to watch his intensity and breathing with his condition CF. So since Danny hasn't exercised in a year, he should talk to his CF care center first, make sure he can be cleared to participate in exercise. You should participate in a 6-minute walk test. This is an easy way to get a baseline for his aerobic fitness. He can walk around the track for 6 minutes, and then we'll take his blood pressure and heart rate. The hand ergometer test is a great way to measure his strength, and we should monitor his perceived exertion, make sure he isn't having an overly difficult time during his exercise. He shouldn't be wheezing or having any chest pain. His vitamin D supplements may cause irregular heartbeat or a heart attack, so his heart rate needs to be consistently monitored. Since the Orkambi, his medication he's taking, can cause difficult or labored breathing and tightness in the chest, we should definitely be watching that. He should start exercising at a low intensity, and if he thinks he can handle it and he's not experiencing any of those symptoms, we can increase that slowly. He should also use his airway clearance vest and his medications properly prior to his exercise to make sure he's able to breathe to the best of his ability. So here's his exercise prescription. For aerobic fitness, he should be doing it 5 days a week. He should be doing it at 50 to 70% of his max heart rate at a moderate intensity, 11 to 14 on the RPE scale. You should start with 20 minutes for the first week and increase a few minutes every few days, up to 30 minutes of exercise a day. He should be walking or running, which is what he enjoys doing. Maybe do a power walk at the beginning and then increase it up to his normal running pace once he's comfortable. And if he gets bored, he can change to biking or something different that he enjoys. For resistance training, you should be doing that 2 to 3 days a week. Should be at a moderate intensity, 60% of his 1 rep max, 11 to 14 on the RPE scale. You should be using the 8 large muscle group exercises with 10 to 12 reps, and he should be using resistance bands and free weights. Doing core exercises is really crucial for people with CF. By developing a stable core, you're able to have a better cough, which allows more mucus to be coughed up, loosen the mucus and get it out of your system. Using large muscle groups with resistance training is key, so bench press, squats, stuff with the abdominals would be really great to get that core tight, to be able to have that strong cough. And stretching is really key, usually after workouts, or you can do it on rest days. Should be moderate to light. Upper body stretches to increase flexibility in the shoulders and trunk can help improve his posture, making it easier to breathe deeply, which is what we want. Yoga can do that also. So there are certain breathing exercises he has showed me that help him if he can't breathe. There's one with a tissue. He usually puts it out right here, and he takes 3 deep breaths, and then the third breath he breathes out, and you have to make sure that the tissue moves so it flutters in the air with each breath. And after that, he should be able to come with a nice cough to get the excess mucus out of his system. You should be patient and consistent, so people with CF may have to train slower and longer to be able to see results. And if he looks exhausted or exasperated while exercising, he should stop exercising immediately, which is a given. He shouldn't overdo it, and he should just take his time and do what he can handle. Yeah, that's all I have. Thank you so much.